Anxiety and stress levels pretty high for everyone right now during this crisis, right? Well, there's the added concern about the health and safety of those struggling with mental illness. It's led to a local mental health treatment center changing the way they work. Joining me on the phone now, Dr. Claudia P. Welke from Compass Health Center. Thank you for joining us. Tell us about the changes that you're having to make here. You're having to go to virtual treatment.
Good morning, Sally. Yeah, absolutely. So Compass is a partial hospitalization program which specializes in working with patients who are in crisis. And so, a couple weeks ago when everything started happening with the coronavirus crisis, the pandemic, we said it's our responsibility to take care of these patients and to take care of our employees. So we went completely to a virtual platform. It's the only virtual partial hospitalization program in Illinois. We really have taken a strong look at, how to provide this care in a virtual way effectively.
And those patients you're treating, as you talk about, they're often in a crisis. Those are people who can often end up in emergency rooms. Talk about how important it is to keep them out of those ERs right now.
Oh, absolutely. Because these are patients who are in crisis, they are high utilizers of the emergency room and oftentimes require inpatient hospitalization. We all know that we need to keep the ERs free right now for everything that's happening with the pandemic. And so, what we do is we have them access our care. These patients are assisting in group therapy, individual therapy, family therapy. I like to say we sort of envelop them in care, along with, having a psychiatric assessment seen by a psychiatrist several times a week. And our goal is to keep them away from the hospitals right now. And, that's always important, but right now, even more so.
I understand you're also supporting those on the front lines in this, healthcare workers, first responders. Tell me about that.
Yeah, so that's a new program that we're initiating, and as we've been reading about and hearing, those at the front lines of this crisis, they're experiencing their own symptoms. This is a scary time for them. They're worried about their own health. They're worried about the health, bringing something home to their loved ones, and so we just felt like it was our responsibility to develop a program that would, support them, and so really sort of taking a look at arming, healthcare workers with skills that they can utilize to decrease their symptoms, because we know that their anxiety is really skyrocketing as well.
Let's talk about the rest of us. I mean, anxiety for everybody is up right now. People watching at home right now, what do they do if they feel they need help? How do they know they need help?
No, that's a great question. So, I think the reality is that we are all experiencing anxiety. All these questions in terms of the unknowns, sort of leads to, people sort of feeling like, feeling significantly more anxious. And so, what I say to people is, so part of it is normalizing the fact that we are feeling anxious, but really trying to put things in place, not focusing on the things that we can't control, right? We can't control when this pandemic is going to be over. We can't control when we're going to be able to get back to work or school, but focusing on the things that we can do. We can social distance. We can make sure that we're washing our hands, and keeping things cleaner. Keeping things clean around. And so really focusing on those things, becomes important. Keeping a schedule, making sure that you're getting out, even if it's just for a walk. All of those things really become important.
Yeah, I'm afraid we've got to leave it there, but I want to point people to where they get more information. CompassHealthCenter.net is their website. Dr. Welke, thanks for taking the time to talk to us this morning. Stay healthy.
You as well. Thank you.